Hi, my name is Serenity Stubbs. I'm a nursing student at West Coast University, and this is my case study. My case study introduction. Mr. Smith is a 67-year-old male with no significant medical history. He has a family history of heart disease. His brother and father both experienced cardiac disease that required surgical intervention under the age of 50. He is married and has 2 grown children and is close to retirement. He goes yearly for a physical and gets the annual flu shot and had the pneumococcal vaccine 3 years ago. He is up to date with his tetanus toxoid vaccine. He received his last one 2 years ago. The scenario. Mr. Smith likes to hike in the woods and last week went to a new spot. During the hike, he fell down a hill and developed a few scratches on his arms. He felt a little beat up, but was able to finish the hike and went home. 3 days later, one of the scratches became red, inflamed, and warm to touch, and he has a low-grade fever. His wife insists that he visit the clinic. At the clinic, the NP notices that he has bruising on his chest and seems dyspneic at times. Cellulitis. Cellulitis is a bacterial infection that spreads to the deeper layers under the skin. Cellulitis can occur on any part of your body, including your face. A common place to have cellulitis is your lower leg. The bacteria infection can become serious if it's not treated quickly with antibiotics. The etiology of cellulitis is that it commonly occurs when bacteria enters through a cut, scrape, insect, bite, blister, or other break in the skin. Cellulitis is most often caused by bacteria like Streptococcus species or Staphylococcus aureus. Staphylococcus is a group of spherical bacteria that live on a human skin and in the nose. The bacteria can be harmless but can cause mild to life-threatening infections. The Streptococcus is a gram-positive bacteria that often grows in pairs or chains. Some types are harmless and live naturally in the human body. Others can cause mild to life-threatening illnesses. The risk factors for cellulitis include anything that makes it easier for bacteria to enter the skin or harder for the body to fight infection. Breaks in the skin, cuts, scrapes, and abrasions, falls, and traumatic injuries, insect bites, surgical wounds, burns, cracked skin from dryness or eczema. The pathogenesis of cellulitis. After bacteria enters the tissue, the bacteria multiplies and spreads through the dermis and the subcutaneous layers, triggering an inflammatory response. This leads to redness, warmth, swelling, pain, and tenderness at the affected site. As the immune system responds, symptomatic symptoms such as fever and malaise may develop. The clinical manifestations. Symptoms of cellulitis may include pain, tenderness, edema, warmth, discoloration, red, purple, or slightly darker, fluid-filled blisters. Skin surface may look lumpy or pitted, like orange skin, fever, chills, and fatigue. In more severe cases, patients may develop lymphangitis, abscess, formation, bacterium, or sepsis. The treatment for cellulitis focuses on eliminating the infections and preventing complications. Mild cases are usually treated with oral antibiotics that target common bacteria such as streptococci and staphylococci. The affected areas should be kept clean and the involved lymph may be elevated to help reduce swelling. Pain and fever can be managed with appropriate over-the-counter medications if medically suitable. More severe cases or those associated with systematic symptoms such as high fever, rapid progression, or signs of sepsis may require hospitalization and intravenous antibiotics. Thank you so much for listening to my case study 2 on cellulitis.